Hi guys, I'm Danny West and you're back with another episode of the SOAPBOX, your patient education station. And today I thought we would chat a little bit about one of the most important things I deal with in my practice, and any health practitioner for that matter, and that is the issue of pain. So I am by no means a pain expert, but kind of one of my heroes, if you don't know this already, is Lorimer Moseley David Butler. They're two leading kind of researchers in the pain science world. And it's super interesting. I could geek out all day about this. And one of my initiatives this year was to try to learn a little bit more about pain science and how can I communicate that to my patients or say even kids, because that is quite a large population of who I see. So I thought we would keep it super simple today. I like simple, and chat about pain in relation to, say, an ankle sprain, okay? And if I teach you anything over the next kind of 5 minutes, I want you to at least take away that pain does not mean damage, and pain is just an output from the brain, okay? So again, I'll circle back to that. So if we think about an ankle sprain, okay, and again, you can watch my SOAPBOX episode on ankle sprains explained. But if we keep it super simple and just talk about, say, like when you roll your ankle or an inversion sprain, so you roll it kind of out like this. There are three little ligaments, three little seat belts on the outside of the ankle, and they can get stretched, sometimes so much that they can tear or totally break. And again, like with an ankle sprain, a lot of the time, like we've had them where we just roll our ankle and we just kind of walk it off and it goes away. Well, I want to kind of teach you about pain in relation to, like, well, what's going on there? Okay, what's going on in an ankle sprain? And this has really helped me just kind of, for my own knowledge, understand what pain is a little bit more by thinking about it this simply. So those ligaments get stretched. So if we look at stages of healing, for this ligament or these ligaments to be fully healed, the kind of rough guide we give people is 6 to 8 weeks. So that's 2 months. And again, that's a really basic kind of ankle sprain, okay? So no breaks involved or anything. That's how long the tissue takes to fully heal. Well, I ask you, if you've had an ankle sprain or an ankle roll, does it take that long for the pain to go away? No, not at all. Usually with like just a small roll or ankle sprain, you'll notice that the pain pretty much goes away. Again, no complications within about like 2 weeks, 7 to 10 days, okay? So that is an example of where pain does not reflect damage. Pain does not reflect, has that tissue healed? And this is super important, okay? And like this to me will change the world, because if you learn a little bit more about pain, I really question how much we would have a chronic pain problem in the world. I would really question if we would still have all these long wait times for surgery. I would question if we would have this opioid crisis where people are just going to drugs because they're so desperate to relieve the pain. So it's, again, with Lorimer and David Butler's work, they have shown that if you understand your pain, you will start to hurt less. And this isn't a quick fix, okay? But again, let's bring it back to keeping it simple, the KISS principle, okay? So we have this person, they sprain their ankle, 2 weeks later the pain goes away, and they go out and play sport. Well, as a physio, I'm thinking, okay, I know that the final stage of healing doesn't actually happen until about the 6 to 8 week mark, okay, or the remodeling stage, as we would call it. That's when the ligament, the structures of the ligament, gets to kind of be a little bit stronger, or at its strongest. Not as strong as before the roll, but kind of the best it's going to get is at about that mark. But then we have people that, again, the pain is gone by 2 weeks. So you cannot use pain as a gauge for damage. Okay, and this is really a huge take-home moment. This didn't really sink in for me until about 2 years after physio school. So if I didn't know it, well, how the hell are patients supposed to know this, okay? I'll give you another example of how pain doesn't reflect damage. Think of an amputee. So if you've learned about amputations and that kind of thing, you might have heard of what's called phantom limb pain. So basically, if I kind of was amputated from the elbow down, okay, so this is gone, I have a prosthetic, people will describe pain in their amputated hand or in that limb that's gone. So how does that make sense, right? So now you have a limb that's totally gone. So we know like there's no tissue that's damaged below the elbow, it's gone. But they can experience excruciating pain. So again, another example of how pain does not correlate with tissue damage, all right? So think about chronic pain now. So chronic pain is any pain where you've had it longer than 3 months. And as soon as you've had pain for longer than 3 months, the brain actually changes, your body actually changes how it processes pain. This is like beyond your control, okay? This is what's going on in the inner workings of your mind. Now, a lot of people hear this and they think, oh, okay, so you're saying like pain is all in my head and I'm making it up. Kind of yes and kind of no. So first off, pain is always real. Pain is 100% always real, okay? The reason you have pain is what varies person to person, but pain is always very real. What we mean by pain is an output from the brain is that's not something under conscious control, okay? So again, the wiring to our brain, the messages being sent to our brain and how our brain interprets that will change if you've had pain longer than 3 months, okay? The wiring system has changed. So if we go a little bit more brain sciencey here, you basically have a map in your brain that says, oh, this is what Danny's hand looks like in space. This is what her elbow looks like. This is what the shoulder looks like. So you have a map in your brain of your entire body. And let's go back to the ankle. So I sprained my ankle. As soon as I experience pain, so again, let's say it's a cranky ankle, more complex, pain's still sticking around after 3 months. You remember these? Okay, so I'm stealing this demo from David Butler because I love it. Okay, so it was hard to track one of these down, but think of that mapping in your brain. So we'll say, pretend this is your ankle, okay? But I sprained my ankle, and so this is the brain's idea of all the contours of my ankle, all of the nooks and crannies. It's proprioception, okay? So your brain has a clear image of that ankle pre-sprain. As soon as I have pain longer than 3 months in that ankle, what happens to that map? Suddenly, it doesn't look so clear anymore. And we call this smudging, okay? And this picture in the brain is located in what's called your somatosensory cortex. And that mapping gets smudged. It's called smudging, like in the pain science world. That's actually a thing. When you get that smudging, that's when you can start to experience, oh, now my pain's kind of spreading. Now I feel like it's going up my leg. Or now I just feel like, it's hard to describe, it's just all around my ankle. It's really hard to tell. That's because the mapping has been smudged. And that is why the pain can start to spread. Because there's not a clear picture in your brain anymore. It doesn't really know where the ankle is in space. Okay, and that's where we now actually have to retrain the brain or the image the brain has of our ankle. Okay, super cool. Now, if I've had pain longer than 3 months for an ankle sprain, I know as a healthcare practitioner, and what I'm trying to teach people is that tissue has physically healed after 8 weeks. It is healed. Okay, again, no fracture there. We're talking just a simple ligament sprain. That tissue is intact. So then why would you still have pain when the tissue is healed? Okay, so it can work on the flip side. Okay, you can still have damage, or that tissue can be technically not fully healed and you can have no pain. Or on the flip side, that tissue can be totally healed from a stages of healing standpoint, but people can still experience excruciating pain. So that means that pain does not correlate with tissue damage. Pain is an output from the brain. And unfortunately, the reason a human can experience pain is because we have one of these. We have a brain, we have emotion, we have multiple areas of the brain. And unfortunately, it's not one thing that's causing the pain. It's things like social support. It's, am I traumatized with this pain? Have I injured my ankle before, and was that a really bad experience? How old am I? Do I feel support from my parents, from my colleagues when I'm healing? Do I do well with pain? Have I been injured before and it went really bad? And the list goes on and on and on. All of those factors, the brain is processing, okay? And it's taking in all this information and basically comes up with then a pain signal based on all of those factors. But that's why pain is so complex, is it's multifactorial. You can decrease the pain. So people that are in chronic pain, you can decrease your pain. Unfortunately, not with a quick fix or a pill, but with brain retraining. Okay, and that is, I find, the piece that is often missed in, say, a fast-paced clinic. They literally can't accommodate this kind of education. There's no time. But think, how important would this have been to know, like in school or when you were growing up, that you don't need to be afraid of pain. If you have a lot of pain, that does not necessarily mean you have a lot of damage. And I think especially for kids or somebody that has had pain for a while and is scared of moving, scared to get pain, that's a huge golden nugget of information that can really start to change how they see their pain. And that is the type of thing that I think will change the world if we, again, try to encourage this information to spread. So I'll try to do a few more little pain snippets. Again, I'm by no means like a pain scientist, but I'm super passionate about learning more about this, because if it's revolutionary to me, not in pain, but as a health practitioner, think of what it could do for somebody that is in chronic pain, okay? So start to spread the word that pain does not correlate with tissue damage. Pain is just an output from the brain. And the most important thing is motion is lotion. So do not be afraid to move, and this is all relative. You need to find somebody that can coach you through what is the right amount of movement to, again, not flare you. And I think that's super important, and a hat that us physios need to show the world that is our profession, is we are movement coaches. And the number one thing in all the research, no matter what the injury, is movement heals. You need to get up and move, again, within reason. And I think we've lost that piece a little bit with all these fancy machines and doohickeys and magic pills and searching for a quick fix. It's a process, but movement is key, and so is the brain retraining and education on what pain is. So start spreading the word. Motion is lotion, and pain does not necessarily mean damage. And I think if you each told 5 people that, this could revolutionize the way we see pain. Okay? Anyway, pretty deep soapbox for today, but that again is skimming the surface and just trying to get you to reevaluate what pain is and how you don't need to be afraid of it. Okay? Thanks, guys. I'm Danny West, and we'll see you next time on the Soapbox.